Welcome back YouTubers to my channel of an everyday life up in Aspie. If you're new, I welcome you all. I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories with Aspie syndrome and the like. So if you're into any of these and more that I'm going to bring out to you, feel free to subscribe at the bottom right hand corner. And once you do so, feel free to turn on the notification bell so you don't miss any future videos or future updates that I do. So as you're aware right now, I am doing the drug awareness series before the big project that I'm hoping to show you all in the next month or so. And in saying this, these ones are going to be a bit more in depth of the different drug types, which I'm going to only talk at least the 10 common ones for you guys to understand and follow through step by step. So the very first one basically is heroin. Heroin is a highly addictive analgesic drug derived from morphine that is often used illicitly as a narcotic producing euphoria. It is made from morphine, also a natural substance taken from the seed pod of the various opium poppy plants variety that are grown in Southeast and Southwest Asia, Mexico and Colombia. Heroin, as we know, can be a white powder or brown powder or black sticky substance known as black tar heroin. So the common names for the heroin are as follows: the big H, horse, dust, hell dust, and smack. The type or class of the drug is obviously an opioid drug made from morphine, as sometimes this can be substituted as pain relief, as you are well aware, which I'll link in the eyeball above me as well as in below me too. Now the classification of the drug, of how it's made and the chemical structure of it, will be above me to show you right now. Well, that's a good question. Heroin's effects last longer than the effects of drugs like your cocaine and meth, but it has a particularly short lifespan of 30 minutes only. This means that if a user takes a single dose of heroin, it will take up to 30 minutes for half of the drug in the person's body systems to be flushed out. However, some studies have suggested that this half-life is as short as 3 to 8 minutes. However, the actual time this takes for each individual will depend on those following factors that I've clearly addressed: your height and weight, your age, your genetics, your body fat content, the amount you've taken, the quality of the drug, the metabolism rate, health of the liver and kidneys, and your hydration. Heroin. The rate at which heroin leaves the body, of course, affects how long it will take during the substance is no longer detectable in various drug testings. The drug tests approved by the Food and Drug Administration for heroin are those for the blood, saliva, urine, and hair follicles. Newer, more advanced tests, however, can be detected or can detect traces of heroin in the system for a longer period of time since the last dose that has been administered. Many tests now look for heroin metabolites, which are created when the liver metabolizes the drug. These stay in the system much longer than the actual intoxicant itself. Most of the time, heroin is no longer detectable in a person's urine after just 2. However, certain tests have known to have a positive result for this drug for up to at least 7 days. Blood and saliva tests aren't often used for heroin due to the fact that this opioid, like many others, has a short half-life. It can therefore take only 5 to 6 hours for the drug to become undetectable in these body fluids, though it can possibly be found for up to 2 days, if lucky. The only test that works for longer than a week is the hair follicle test, which can detect heroin for up to 3 months or more. However, there are many possible other factors that can interfere with hair test though. People will use it as a form of injection, they'll sniff it, they'll snort it, or even smoke heroin. Some people mix heroin with crack cocaine, a practice called speedballing body. Heroin enters the brain rapidly and binds to opioid receptors on the cells that are located in many areas, especially those involved in feelings of pain and pleasure, which is obviously your neurotransmitters versus your neurons of the nerves, and in controlling the heart rate, sleeping, and breathing. In the long term, People who use heroin over the long time period may develop the following symptoms: insomnia, collapsed veins for people who does tend to inject the drug, damaged tissue inside the nose for people who sniff it, infection of the heart lining and valves, constipation and stomach cramping, abscess, which is a swollen tissue filled with pus, liver and kidney disease, lung complications, which would include pneumonia, mental disorders such as depression and antisocial personality disorder, sexual dysfunction for men, irregular menstrual cycles for women. Side effects that you'll see: people has reported that they'll have a feeling of a rush-like feeling, a surge of pleasure or euphoria. However, there are more common effects that include the following: your dry mouth, warm flushing of the skin, heavy feeling in the arms and legs, nausea and vomiting, severe itching, clouded mental functioning, going on the nod, a back and forth state of being conscious and semi-conscious. Be asking, yes, it is highly addictive. People who regularly use heroin will often develop a tolerance, which means that they need higher and or more frequent doses of the drug to get that desired effects that they're looking for, be it being on a high, be it whatever it may be. A substance use disorder, or SUD for short, is when continued use of the drug issues such as health problems and failure to meet responsibilities, work, school, home. This can range from mild to severe of the substance use disorder. However, the most severe form is being of addiction. Those who are addicted to heroin and stop using the drug abruptly may develop or have several withdrawals-like symptoms, or withdrawal in itself, which these symptoms can begin as early as a few hours after the drug has been last taken. And the rest of the symptoms may include restlessness, severe muscle and bone pain, sleep problems, diarrhea and vomiting, cold flashes with goosebumps, which means you're going cold turkey obviously, uncomfortable leg movements, kicking the habits, and severe heroin cravings and abuse. Naloxone is a medicine that can treat an opioid overdose of any kind when it is given right away. It works by rapidly binding to the opioid receptors and blocking the effects of heroin and any other opioid form drugs. Sometimes more than one dose may be needed to help a person to start breathing again, which is why it's important to get the person to an emergency department quick, smart, to receive that additional support that they need. Naloxone is available as an injectable, which is a needle solution, a handheld auto-injector, which is known as Eviso, and a nasal spray, Narcan nasal spray. Friends, family and others in the community can use the auto-injector and nasal spray versions of naloxone to save someone who is actually overdosed treated. A range of treatments including medicines and behavioural therapies are available and are effective for helping people to stop the heroin use or any form of drug use at this point. It's important to match the best treatment approach to meet the particular needs of each individual patient, however. There are medicines being developed to help the withdrawal process. The FDA approved lofexidine, an opioid medicine designed to reduce opioid withdrawals-like symptoms. Medicines to help people stop using heroin could include buprenorphine and methadone. They work by binding to the same opioid receptors in the brain as heroin, but more weakly reducing the cravings and withdrawal-like symptoms. Another treatment is naltrexone, which blocks the opioids, which I have said before, opioid receptors, and prevents opioid drugs from having an effect. An NIDA study has found that once treatment is initiated, both a buprenorphine or naloxone combination and an extended release naltrexone formulation are similarly effective in addiction. Because full detoxification is necessary for treatment with naloxone, initiating treatment among active users was obviously difficult for the most active users. But once detoxification was complete, both medications has the simple effectiveness on how to kick back the habit. There's also behavioral therapies for heroin addiction, including methods such as cognitive behavioral therapy and contingency management. Cognitive behavioral therapy helps modify the patient's drug use expectations and behaviors and helps effectively managing the triggers and stresses. On the other hand, contingency management provides motivational incentives such as vouchers or small cash rewards for positive like behaviors such as staying drug free. These behavioral treatment approaches are especially effective when they are used along with the right form of medicines. Well, this quickly ends a short overview of all about heroin. Hopefully you like this. Smash the like. Feel free to comment below. Feel free to share these videos around. Let me know if any of you have used this form of drug, and if so, basically, if you want to share your story, how you kick back the habits, and you know how you felt when you first started. You know, as we know, sometimes we should be able to share our stories, you know, and whatnot. So, enough for the day, guys. Thanks for support. Thanks for watching. Do what love you do. Till next time, Aspie signing out.